happy Saturday. All right,
Happy
as you see
Saturday.
here, happy Saturday. As you can see, this video is being live streamed. We are on YouTube, and I'm so excited, so super excited to be hosting my very first women's breast cancer event. We have a bunch of wonderful, lovely speakers coming through, and we're going to start with the wonderful Melissa. I'm going to make you pin you, so it's your main picture on here, Melissa. And yes, and you can get started, girlfriend.
Sure. I'm just hoping that I can share my video. I mean, share my presentation. That's one thing I'm having trouble with. Can you still see me?
Yep, we see you wonderfully. We have your name on the screen.
So my name is Melissa Person, and I have my method and mindset to not just prevent cancer or survive cancer, but to kill cancer. I just like to tell you a little bit about my cancer journey. I was hit by a drunk driver. Just to talk about adversity, in 1993, I was life-started to hospital for special surgery. I was there for 6 months. I had 10 surgery, and I had 5 years of rehabilitation because I was paralyzed. And I tell you that as a precursor to the type of resiliency you need to have when you have cancer or preventing. In 2006, I was diagnosed with ovarian cancer. I fought cancer from 2006 to 2007, full hysterectomy, chemotherapy. I was depressed. I was 79 pounds and I was near death. So what I did is I researched integrative and alternative options because I knew that I had to do something to save my life. And at the time I was 37 years old and I had a stepdaughter and a son, a biological son that also needed me. In 2005, I was diagnosed with basal cell carcinoma. I had surgery, topical chemotherapy. And here I thought my cancer journey was over. I thought that, I beat it. I had gone integrative, alternative, clean living lifestyle. And then I got the wind knocked out of me. In 2010, I was diagnosed with left breast cancer. I had lumpectomy. And here's the reason why I chose lumpectomy is because I wanted to keep my breasts because I had all of my gynecological parts removed. I had the full hysterectomy, the ovaries, the fallopian tubes, the cervix, etc. So I was really sick with chemotherapy. I went down to 99 pounds. And I saw that I was going through exactly what I went through when I had ovarian cancer. And what I learned from that was I couldn't poison myself to health. So I decided to quit chemotherapy and radiation. And then I was diagnosed with right breast cancer in 2011. I decided to do that with only lumpectomy, and that was my personal choice. In 2010 and 2011, immunotherapy was not a common practice. So I probably would have elected immunotherapy as opposed to conditional or traditional chemotherapy and radiation. And I probably would have requested proton therapy, but proton therapy wasn't very popular in 2011. So here I thought my cancer journey was over with. And then in 2013, I was diagnosed with squamous cell carcinoma. My grandmother died of squamous cell carcinoma. And I had surgery and I did topical chemotherapy. I don't know if anyone has experience with Carrick, but it's kind of like getting a face peel on a daily basis. Your face turns red, it burns, it hurts. It's not pleasant at all. And then in 2014, I was diagnosed with squamous cell carcinoma again, and I had more surgery on my right shoulder. And I've been very fortunate. I've been cancer-free ever since, and I just graduated from the Memorial Sloan Kettering Cancer Center to the RISE program. I'm not going to say that life is perfect or that I don't get scared about receiving cancer again. I do, but I pray to God. I make sure that I, live a clean lifestyle. And some of the things for me, my key factors were, I felt that, I needed to, keep my body as healthy as possible. Some of my key factors are faith, prayer, meditation, positive attitude, perseverance. I also, while having cancer, I also made sure that I forced myself to exercise. So with Pilates, yoga, spin, free weights, walking or jogging, heavy bag or speed bag, ropes and TRX. One thing I do want to say is that when we have gluten and dairy, they are cancer proliferators. And I'll talk a little bit about what dairy does for you. So dairy doesn't help you with your bones. It deteriorates your bones. Dairy is actually a cancer manifestation. It creates asthma and allergies. It creates osteoporosis and osteopenia. At all costs, we really shouldn't have any type of dairy. And if you look at it, if you look at the animal kingdom, after weaning, an animal doesn't drink anything but water. They don't drink milk. And we should be doing that as human beings. It's very bad for you. So I have like oat milk. That's my favorite, oat milk, but I also can do almond milk or coconut milk. Not a fan of rice milk, but some people are, or hemp milk. Now, regarding gluten or any type of breads, gluten is very, very bad for you. Gluten can actually, gluten turns into sugar. And as we know, sugar is a manifestation of cancer as well. So from that perspective, I stay away from high sugar. I eat low sugar or no sugar foods and organic foods. And I make sure that I stay away from gluten. Now, do I cheat? Absolutely. Do I have dairy or an ice cream sometimes? Absolutely. But I have a food hangover because my body is so not used to it. But I want to talk specifically about preventing cancer for yourself. And here's the reasons. Because in everyday products in the United States, especially, we don't have labeling laws. We actually allow poisons internally and externally, topically on a body. There's parabens, and they're in adult and baby shampoo and many other products, and they're estrogen mimickers. There's triclosan. It's ingredient in antibacterial soap and antibacterial soap, and what it's linked to hormone disruption, which is the emergence of bacteria and superbugs, in addition to
recording in progress.
It's also to we also have fragrances, and everyone likes to wear perfume, and me too, but I try to get clean perfume because there is various scenting chemicals. There's a problem. I'm hearing an echo, and I'm not sure why. And then there's
it's Renee. Somebody has to mute Renee.
They're found in lotions, moisturizers, makeup, sunscreen. So make sure you read your ingredients. Phthalates, they're hormone disruptors. Any hormone disruptors can create male and female, abnormalities, genital abnormalities, liver and kidney lesions, asthma and allergies, and they can also cause cancer. Petroleum. This is a really disgusting but interesting fact. So the oil companies thought of a great idea. All the sludge on the bottom of the oil barrels, they decided that that was a toxic waste. Just like when you get an oil change at a vehicle, you pay like a toxic waste price. So what they did is they decided to sell these to cosmetic companies, and they used that petroleum oil, also known as and paraffin. And what they do is they fillers in our product, very high contaminant causing agents. And we need to make sure what we put on our body and in our body is healthy for us, not toxic for us. Like talcum and cornstarch, they're all kinds of powders. They're cancer causing, they're asthma, they're allergies. So we just need to be careful. I just caution you to read your labels. And if it's something that you don't know what it is, it's probably bad for you. Here's another example, mercury. They used to be in our thermometers. Now they're in our energy efficient light bulb. Don't ever use an energy efficient light bulb. It's full of mercury. It's bad for you. It used to also be in mascara. They're a neurotoxin, and they can cause severe health damage, in particular cancer. Lead was another thing. Lead was in coloring. and lead was in lipstick. How many times do you lick your lipstick a day? Just be careful. Sodium lauryl sulfite, it's predominant in toothpaste and shampoo, shaving cream, and bubble bath. And what I do is there's a YouTube called The Story of Cosmetics. And I implore you to watch the YouTube Story of Cosmetics. It's really disgusting what the United States have. In particular, the United States bans 12 chemical toxins. Europe bans 2,500, just to give you an indicator. And in 2018, a research study was done by Mount Sinai. And in pregnant ladies, they monitored for 9 months. And when their newborn babies were born, they had over 200 chemical toxins in their bodies. These babies, because of the shampoo, the eyeshadow, the lipstick, the body lotion, the deodorant, the blush, etc. Here's another fact. 2019, did a research study on the vitamins we buy off the shelves because there aren't labeling laws. 90% of the herbal supplements that you purchase don't have the ingredients that they say it does. And as we know, these dangers of these chemical toxins, low testosterone in men, unexplained weight gain, central nervous system disorders, joint and inflammation, acid reflux, breast cancer, ovarian cancer, back pain, IBS, irritable bowel syndrome, colon cancer. So for me, I eat clean, I live clean. I eliminated allergenic, acidic, and addictive foods, increased my nutrient uptake, I balanced my blood sugar, and I supported my elimination. So basically, you should never eat refined sugar because it's acidic and addictive. You should never eat dairy because it's acidic and allergenic. You should never eat gluten because it's acidic and allergenic. You should never eat soy because it's acidic and allergenic. Coffee is also acidic and allergenic. Alcohol is acidic and allergenic, and corn is acidic and allergenic. And the United States is defined by giving people refined food. We are the most obese people in the world because of the chemical toxins that are in our foods. Refined sugars, various colorings, preservatives, and flavors in our processed foods work together and they cause addiction to food. You literally become sugar addicted. What I do is I balance my pH levels. I maintain an alkaline body. I make sure that I eat, a lot of greens like kale, spinach, beets, Brussels sprouts, cabbage, artichoke, broccoli, asparagus, kiwi, pineapple, limes, lemons, chestnuts. Here's an interesting fact about nuts. Any nut from a tree is good for you. Any nut from the ground, like a peanut, is bad for you. Basil is very good for you. Turmeric, dill, celery seed. And I ingest, vegan certified protein. Arbonne is my go-to. In fact, when I was sick with cancer, I lived on the Arbonne 30 Days to Healthy Living and Beyond. It's pure vegan protein. It's 30 grams of protein in the shakes that I make. I also eliminated pork, seafood. I eliminated whey, milk, yogurt, casein, cheese, and ice cream. I don't eat meat. I don't eat pork. I don't eat poultry. But if you do, you should be making sure that it's grass-fed beef, it's clean wild fish, it's organic poultry, kosher certified, vegan certified, are all very healthy components for you. And to get your body to a cancer-killing body, you need an alkaline pH of 7.365. And I actually have a food chart that I can share, or I can share my presentation with everyone. I apologize, I couldn't get it to share on the screen, but I make sure that I eat foods that are 7.0 pH or greater to get an alkaline body. I make sure that I use Alkazone alkaline water because it has potassium in its water, and that's healthy for you. It's also a very good for your animals as well. I make sure that I use like Maranatha almond butter, Honest foods like Honest, oat milk ice cream. I use anything gluten-free, anything dairy-free. and I read labels. The other piece of me and what I want to say is that I have a very strong faith in God, trust and reliance upon God. God gave me the answers that I needed when I was very, very, very ill with cancer. I lived on the bathroom floor, and I didn't know if I was going to poop or if I was going to throw up or do it both simultaneously. I still don't like I can still hear the glass hitting the tile floor because I lived in the bathroom. I don't have to live that way anymore. For me, we know cancer is genetic and cancer is lifestyle and cancer is mind, body, and spirit. So I make sure I have that trust and reliance with God. I make sure that I eat alkaline foods. I make sure that I stay away from acidic and addictive and allergenic foods. And I make sure that I work out all the time. I also make sure that I'm a good person, that I behave in a fashion that God would approve of. My life is about helping others and saving lives and teaching people how to have healthy lifestyles. And I grew up working for Aetna and as an entrepreneur. And it's interesting because we were forced to be COVID-19 vaccinated. I did get very ill with COVID-19. I can tell you that I had an allergic reaction to the mRNA. The studies have shown that if you have autoimmune disease or you're a cancer survivor, now they've learned after the fact that you should never get the vaccine. So it's very interesting what's going on in the world. So you are your own health advocate. You are the CEO of your life. Make healthy choices. And thank you for letting me share.
Hey, I was muted. You had me going, girlfriend. Wow. I'm going to open up the mics. We had a little switch of who was going to speak. Guys, this is Melissa. And if you didn't come in when she first began, I actually met her probably 7 or 8 years ago when I actually heard her speak at an Arbonne event. And then she was speaking a lot. And I was so impressed by her story. And I saw Deborah looking when you were talking about what you don't eat. Can you share with us what you do eat? Because I know Deborah was like, when you're like, I don't do this, I don't do that. What do you eat?
Okay, so to be honest with you, I live on my Arbonne shakes. It's a meal replacement. I eat salads, organic vegetables, grains, like I do gluten-free oatmeal, fruits, various fruits and vegetables. Anything usually green is healthy for you. I make sure that I also eat, I have a shake for breakfast, always. That's my go-to. For lunch, I'll probably have a salad. Now, I do eat fish, so sometimes I'll have salmon or tuna, but it's never farm raised. It's always wild. For dinner, sometimes I'll have a shake, or for dinner, gluten-free pasta. I happen to like chickpea pasta. That works for me. Also, there's tinkyata, which is a brown rice pasta. It's tasty. It's funny because every one of my friends who has celiac comes to me because I'm like the tester of what's the good gluten-free food and what's the good dairy-free food. I'm trying to think, what else do I do? So Maranatha, Honest, ice cream, creamer, Honest oat milk. I'm trying to think what else. The gluten-free pretzels, Snyder's gluten-free pretzels, I'll do. Trying to think what else. There's, Garden of Light. They have, gluten-free, dairy-free, tortilla chips.
Deborah, I see you smiling. Deborah, you have a question?
Sure, absolutely.
You guys could just hop in if you have any questions. Or when were you very first diagnosed with,
So I was first diagnosed, it was 2005.
Wow. And does it run in your family?
Absolutely. Most of the females in my family on my mother's side have had cancer. They've had multiple cancers and eventually died from cancer. My cousin is like a survivor of an acute subtype leukemia. She treated at Johns Hopkins. I treated at Memorial Sloan Kettering Cancer Center for ovarian and breast. My mother treats at the Carol G. Simon Center in Morristown, New Jersey. It happens to be my girlfriend Katie's mom, who that is, and her father was a senator. So my mom for breast cancer, my grandmother died of squamous cell carcinoma. My other aunt died of pancreatic cancer. Another aunt died of ovarian cancer. Trying to say.
Wow.
So we
It
have,
does run in your family.
yeah.
Yes. Well, Melissa, I just want to say thank you. Thank you. I mean, I've heard your story many times, but it just seems like, I guess you're opening up more because I've heard more now than I ever had before. And it's like, wow, you've gone through a life. So, it seems like it's an extreme. Thank you so very much. Like I said, this is recorded. So if you guys missed the beginning of her story, you can hop on. So let's give her a round of applause. Yay. I'm going to change the screen and bring my co-host up. Her name is, let's see. Let me see if I can change the screen here. Mary
Can I
Kim.
just give Melissa some love and just say,
Oh,
OMG, Melissa, you have my heart over here pounding it's just pounding out of my chest. It just want to come out. And I just want to get to the screen and just hug you so tight and squeeze you till you turn red. Oh God, I just want to give you more and more blessings. And yeah, I would need to talk to you because you had me over here. When you said coffee, I'm like, coffee?
seems like we can't eat it all.
Look,
Lord.
everybody cheats. Everybody cheats. But, and again, I'll be happy to share my presentation with anyone. I apologize. The sharing of my screen wasn't working. I don't know why.
Okay.
No
It's
worries, no
okay.
worries, no
It's
worries.
okay.
So guys, I have the beautiful, the electrical, the majestical, any word that you can think of to say beautiful, Mary Kim. And I'm so excited because when I thought of this event, I'm like, I really don't know who to get. So I'm just going to pass it over to Mary Kim so she can introduce our next speaker. Thank you, Mary Kim.
Yay. Hello, Melissa. I'm Mary Kim Farkas. I know most of you. If not, that's who I am. And Melissa, thank you for sharing your story. It's so crucial. Breast cancer is the second leading cause of death of women since 1989, and it's declined 43% going into 2020, right? So it's crucial, but I've changed my diet in the last year looking at ingredients, and my body has changed the way it functions, how it feels. So thank you for sharing all that. It's so important to read ingredients. And I'm just sharing you, thank you for your vulnerability because you're helping someone today, as you probably know. So thank you, Tina, for having me. Hello, and I'm super excited to introduce our keynote. She has all the accolades. I've known Dr. Anita Singh. I don't call her that in person, but she's a doctor. I've known her since high school, and we've been friends ever since. And I'm so honored to have her. She is a powerhouse, board certified, all those things, but she can go into better because I'm clueless. I can't even change my virtual background. So, but I'm here to introduce my amazing friend. She's going to give you all the nuggets. She's a beautiful soul. You definitely need to connect with her. She'll help you change your life. But Dr. Anita Singh, the mic is yours. Thank you for being here.
You're very welcome. Thank you, Mary, for sharing this event with me. And thank you, Tina from Elite Star Fitness for having me join everybody this morning for Breast Cancer Awareness Month. Did everybody have a workout this morning? Am I correct on that?
No, I'm in California, so it's a time difference. And no, we didn't have a workout this morning.
Oh, okay. I didn't know that because I was like, well, while you guys worked out, I was still trying to sleep here. But I bought my not coffee. I have tea actually along. So please feel open while I talk with you. Yeah, there you go. Kimberly, have your tea, coffee. Well, we were just told coffee is not good, but there is some truth to that because of alkaline, and we'll get into that alkaline acidic, and some smoothies. Anybody has a smoothie? Anything?
No smoothies yet.
You got a smoothie? Okay, there we go. And I'm going for the next 20 minutes. I'm going to take the time to provide you as much as I can with a medical overview and end with some wellness, lifestyle, behavior modification. But there's so much information out there, and the best thing I could do is just give you just an overview of everything, because my end goal here is for each of you to have a few takeaways to keep with you once I am done in the next 20 minutes with everybody. My name is Anita Singh. I am a board certified nurse practitioner. I have over 2 decades in expertise in internal medicine. I have a medical legal background. I have a dermatology background in medical dermatology, so basal cell, squamous cell, not aesthetics. I have a television and media background. I was a medical expert and a wellness expert. So I have spoken for like Angelina Jolie and her BRCA gene, which you'll hear more about, and her decision to have a bilateral mastectomy. I've spoken on obesity, spoken on different hormones and other medical and wellness topics for television. But my passion, if anyone wants to know, is corporate wellness. And I was a provider on site for various Fortune 500 companies, some of which are Carnival Cruise Lines, JP Morgan Bank, and I also speak for Fortune 500 companies and on medical wellness topic and self-resilience. So today I am happy to come here and be with everybody to educate, increase awareness, and prevention as much as possible. And as you can see, we can learn from everybody. Melissa just spoke her personal stories from a personal aspect, and sometimes life experience is very individualistic, but they are very poignant as well. Did you know that breast cancer is the second most common cancer in women? Anybody? Yeah. The first one, of course you do, Melissa. The first one is skin cancer, if you want to know. The first one's skin cancer. And did you know that breast cancer is the second leading cause of death in women? The first leading is lung cancer. The American Cancer Society has estimated about 43,250 women will die in breast cancer in 2022. Half of those, or the majority of those, are going to be more from a diagnosed, what you call invasive breast cancer, and then there's the non-invasive breast cancer. So overall, there's two different types of cancer, but the invasive cancer, unfortunately, is where the majority of women die from breast cancer. Breast cancer rates have decreased steadily. Overall, there is a decline, as Mary mentioned, by 43% throughout 2020. The decrease in the rates is believed to be because of the new screenings that we have, increase in awareness. We have a lot of awareness going on. I don't know about in California, Startina, but there is a lot right now, even right now as we're speaking on, I live by the beach, they're running for breast cancer pink awareness. There's marathons, there's dance-a-thons, there's so much going on that even if you're driving the streets and you don't notice it, then I don't know, you really need some smoothies to be aware it's all over. So we're very aware of it now too. And there's a decrease in HRT, hormone replacement therapy. Since studies came out, we have found from the WHO many years ago, I'd say about 15 years ago, I was one of those people who prescribed it actually. We found out that it's not the best thing to do to keep women on hormone replacement therapy. So with that being decreased now, we have actually seen a longevity in women with breast cancer. A little bit of gender genetics stats. Black women have the highest rate of death when it comes to breast cancer. And the reason for that being is the type of breast cancer, which is mainly the invasive type of breast cancer. They have more of the aggressive type of breast cancer than the Caucasian. However, the Caucasian woman is more highly diagnosed with breast cancer.
Why do you think that is? Do you think because the Black women don't go for testing? Why do you think that is?
So that's a good point, Tina. So one of the major reasons is the type of breast cancer, which I will get into in very little details, but There are breast cancers that are more genetic, like the BRCA gene, which Angelina Jolie had, that she had no choice but to have a bilateral mastectomy. Like the TN, which is a triple negative breast cancer, BC, which is common in the African American Black women genetics. It's a protein in breast cancer that predominantly Black women have. It's more aggressive, and it's probably by under the age of 40. So it's more a protein, it's the type of breast cancer. And there are other reasons like socioeconomic, sure, but I would say the majority is the type of breast cancer that falls within the African American Black women community. And white and Asian Pacific Islander cultures tend to also have, like I said, they fall more into, they are diagnosed more, they have breast cancer more, but their breast cancers are not as aggressive. Although, and we can't forget our men out there. Are there any men on here? But we can't forget them. But there are men are also diagnosed with breast cancer. In 2022, an estimated 2,710 men were diagnosed with breast cancer in the United States this year. And approximately 530 of them will die of breast cancer. So men have to take good note of that. And we do try to encourage it in the medical world when we're seeing patients. Sometimes they look at me like I'm crazy, but it's just reality, and it's part of their self-care as well. So what is breast cancer? Breast cancer is a disease in which the malignant cells form in the breast tissue, in the tissue of the breast. So your breast is made up of so many different types of tissues all over, and vessels and ducts and fibroids all over. But the actual cancer, the malignancy, is in the tissue of your breast. Some symptoms of breast cancer. One of the main ones we see is a lump underneath your axilla. As you're doing, and we're going to talk about breast self-exam, but you'll mostly, I would say the majority of breast cancers are found underneath your axilla towards the right upper quadrants of your breast. Always is the most important part of your breast to check. If you don't check anywhere, check right there. Thickening and swelling of your breast. It's called orange. You'll see it looks like an orange peel. The color changes and it's big dimples on your breast. It's very obvious. It looks different. It looks like a rash, but it's not a rash. Irritation and dimpling of the breast skin. So the skin of the breast, it will look like a dimple, like something's poked inside. Redness and flaky skin around the nipple area. And pulling in the nipple and the nipple area. So pulling means like the skin, it looks like it's tagged on, pulled, like it's actually being drawn out. Those are just some of the major signs of cancer. So there are two types of breast cancer, as I mentioned earlier. There's invasive, and then there's the precancerous. The precancerous is called DCIS. It's the most common precancerous you'll hear ever. What it means is ductal carcinoma in situ. It's precancer that starts in the milk duct and has not grown into the rest of the breast tissue. The other type of breast cancer that is very common is the invasive and infiltrating breast cancer. These types of breast cancers spread and they invade the surrounding breast tissues. And they make up about 70 to 80% of all breast cancer. What are the treatments of breast cancer? So we have lots of treatments, everybody, but I'm just gonna go tap into what are they. One of the major ones is surgery, partial mastectomy and bilateral mastectomy. And that decision is based on the provider, the oncologist, and the plastic surgeon. And depending on what type of cancer you have, that will determine the type of surgery you have. Also radiation, chemotherapy, Hormone therapy. We have hormone blockers because a lot of the cancers are caused because of, we just talked about it, triple negative breast cancer in the Black women community. And then there's BRCA1, BRCA2. We have, those are all hormones, HRT. So there's hormones that we have blocked. We have medications that we use to block them. We have target drug therapy. And what that does is it slows down the growth. It's a new form of treatment, it's very innovative, but it slows down the growth of the breast cancer. And then most recent to today is immunotherapy, where they boost the person's immune system to recognize the breast cancer tissue in your breast, and it targets only that cancer cell and it destroys it. The causes of breast cancer.
Really quick before you go to the next topic. So would you say that the cures are better than they were would you say that the cures are better now than they were years ago? Like, are they saving more lives?
Oh, yes. So one of the reasons that we are seeing a decrease and while there's still death due to breast cancer, there is a decrease due to advanced screening, due to the awareness, but also due to innovative treatments. We will tap into that because I'm trying to give you a little bit of everything in the next probably three slides in my brain. Any other questions? I'm happy. I was going to go through this and take a few. Is that okay with everybody? Let me
Yes.
okay. Well, thank you for your permission, Ms. Brown. The types of breast cancer, the cause of it. So gender, breast cancer occurs nearly 100 times more common in women than men. That's pretty well known. The age, 2 out of 3 women with invasive cancer are diagnosed after age 55. Race, breast cancer is diagnosed more in Caucasian women than women of other races. Obesity, obesity is a risk factor for both men and women. Family history and genetics, as we heard from Melissa Person, did I say that correctly? Is a big, sorry, did you say something, Melissa? Oh, is a big component of it. So if your mother, your sister, your father, a child has been diagnosed with breast cancer or ovarian cancer, you have a higher risk of being diagnosed with breast cancer in the future. Your risk increases if your relative was diagnosed before age 50. So if you have other relatives like an aunt, a maternal aunt, it's before 50. If they have been diagnosed before 50, most likely you have an increased risk. Personal history. If you have been diagnosed in one breast, you have an increased chance of being diagnosed because it spreads to the other breast. Menstrual and reproductive. Early menstruation, early meaning anything before the age of 12, and late menopause, anything after age 55, gives you an increased chance for breast cancer. And certain genome changes, that's the genetic mutations that I'm talking about that I try to emphasize. So the BRCA genes, the TN reactive genes, those are just risks for breast cancers too. Dense breast tissues, which I'm seeing more and more of, and women with bigger breast. Also, we have, it's overall known that dense breasts, we need to start screening a little bit more. And while they recommend a mammogram, I will tell anybody who feels like they have bigger breasts, who feels like their breasts are thick, you can tell, and heavy, to also get an ultrasound. Not giving medical advice on here, but you need to, because it sees right through the mammogram. It's more decisive and more precise. A mammogram alone is not enough, but the breast tissues in your breast are so thick that they're so lumpy and they're hard to detect on a mammogram. Environmental and lifestyle, which is probably everybody's big thing here. So lack of physical activity, a sedentary lifestyle. Who has heard that's good for you in anything? For your mind, for your body, for your, I don't know, for anything. So move. They really recommend that. Move, get going, exercise. A poor diet. A diet saturated in fat, a diet lacking fruits and vegetables can increase your risk for breast cancer. We will talk a little bit more. I know Melissa went over her own personal journey with that as well. Being overweight, obese. Obesity and being overweight can increase your chance for breast cancer. Drinking alcohol. Frequent consumption of alcohol can increase your risk for breast cancer. The more alcohol you consume, the greater the risk you are for breast cancer. Chest, radiation to the chest. So if you're someone that has other medical issues or diagnoses and you need frequent radiation, that also is a big risk for breast cancer. And combined hormone replacement therapy is also an increased risk for breast cancer. So now, how do we prevent breast cancer? We can't take it, it's not a cure. We don't have a cure yet. Hopefully we will, but how do we prevent it? So some new studies have come up. I've tried to pull up some of the most recent innovative studies we have for you, but obviously the sedentary is one of the risk factors. I would tell you that physical activity, losing weight, eating certain foods, certain types of diets, which we'll get into a little bit, really we'll tap into, is very, very beneficial to lower breast cancer. Some hormonal medications, such as tamoxifen, raloxifene, we use that to help lower breast cancer risk. Clinical trials also we're doing for non-hormonal drugs we're still working on that to lower breast cancer risk. And studies are looking at some vaccines. This may not agree with everybody on here, but some vaccines right now to help prevent breast cancer. That's one of the newest studies they're trying to pull to see if there's any to help with breast cancer, decrease the breast cancer, prevent it. Biomarkers. So that goes back to the HR2, the protein that I mentioned to everybody, BRCA1, BRCA gene, and then the TN BRCA, which is the triple negative breast cancer, which is more common in the African American gene. So all of this is what we call biomarkers. So American Cancer Society is coming out with where we draw blood and we can try to see if we can get these biomarkers to test before the mammogram picks it up, before the ultrasound picks it up. So, and then the other types of innovative studies they're doing is a more detailed, they have a PET scan and we have something called the CAT scan, but they're trying to come up with more innovative tests that'll hone in more specifically and more detailed for the breast. We have other breast cancer treatments that are coming out, such as targeted drugs, like I mentioned, specifically for the actual lump in the breast or for the actual tissue, I should say. Some better supportive cancer treatments during chemotherapy. So when you're going through chemotherapy, there is so many side effects. So they're trying to come out with meds such as, well, with chemotherapy, one of the side effects, for example, is damages to your nerves. So they're coming out with medications to assist with that. They're coming out with medications to help with any kind of blood pressure or heart damages during that cycle of new chemotherapy. And then for this crowd, I went a little bit and I did some research on lifestyle, mindset, and self-care, because that's what it's all about at the end of the day. Yes, we can prescribe medicines. Yes, we can do chemo. Yes, we can do radiation. But I truly believe whether you have breast cancer or not, lifestyle, mindset, and self-care is a preventative modalities, which can assist and support you during breast cancer and even before hopefully it's more preventative. So some familiar Self-care, what is one of them? BSE, breast self-examination. So Melissa's laughing at me, but yes, in your shower, we all take a shower here, I hope. When you take your shower, the best thing we advise our patients is to take some soap, organic soap if you want to, and then take that, and as you're rubbing your skin, feel your breast. And what you do is you feel it in a circular way. Don't pick up, because if you pick up and you tap, you can miss a spot. So keep feeling with the soap, and it'll glide. And that's one of the major ways. And believe it or not, reality, not textbook. After my 20 years, it's during my husband found my breast cancer. And that's the majority. A lot of women come in saying to us because they feel a lump, and then the women comes to us. Nutrition is a big important factor. More protein for more strength and more energy, because when you get hit with chemo and radiation, you are knocked down, you're damaging the good cells. Some healthy foods that reduce breast cancer is green leafy vegetables. Kale, spinach, collard greens are some, for example. Berries, citrus fruits, fermented fruits, prebiotics, probiotics, fatty fish, salmon, beans, spices, herbs are all what is recommended are some foods that you can start eating. Mindfulness. Mindfulness is the ability to be fully present and aware of your thoughts, your feelings, and your surrounding environment. We all have heard there's a powerful connection between mental health and physical health. So I think that is something we all have to keep in mind as while we go through this journey. And I don't think this is just pertaining to breast cancer. This part, I think mindfulness is important to how we live our lives now. Being present, being in the moment with our mental health, but also our physical health. Growth mindset. So I'm going to go over a few mindset tools that can help anybody implement and develop a new mindset and lifestyle habits for breast cancer, but also for your life. One is address self-limiting beliefs. Who has that? What is that? Well, we call it that voice in our head that I call stalks me and comes out every once in a while, but we want to reframe that. Replace automatic negative thoughts. It's called ANTS, A-N-T-S, automatic negative thoughts. Focus on being in the present. Practice self-reflection by journaling. A gratitude journal is good for everybody. So take out a journal, get yourself a journal, and start writing something that you're grateful for. And sometimes it's mind over matter. So I've learned something that someone shared in me, and it was a patient. I worked in oncology too when I was a nurse way back in the days, about 30 years ago. And she said to me, thoughts held in mind produce of its kind. Think about that. Thoughts held in mind produce of its kind. So what you fill your brain with and your mind with can really infiltrate your cells at a molecular level. So change those, flip the script. Build principles of resilience. Some optimism, hope are some traits of resilience. So you really have to rely on your resilience as you're going through breast cancer, but in your life too. Yoga and meditation. There's some free comfort meditation series for specifically targeted and for specifically for patients with yoga and patients with breast cancer and patients who are also going through chemo and radiation. There is also, it's called Yoga for Cancer Online. That's another tool or resource you can look up. So to recap, we went over some statistics. We went over some symptoms. We went over the 2 stages and the stages of breast cancer. So there's 4 different stages. I forgot to bring that up. So let me just go back a little bit. There's non-invasive, and then there's the invasive types. And then there's the stages. There's 0, which is the one I mentioned to you, that's the non and precancerous. And then it goes, we grade it. Stage 1, 2, 3, and 4. 4 means that it's not just in the breast tissue, it has now metastasized to its surrounding organs, the lungs, the bone, etc. And then we went over a few treatments. We talked about risk factors, preventative measures, and some lifestyle and mindset modalities. I want to end with this quote: optimism is the faith that leads to achievement. Nothing can be done without hope and confidence. And this is by Helen Keller. So thank you all. I hope I gave you even just 2 takeaways today.
Anita, that was Dr. Now I'll open up the floor if anyone wants to ask any questions, but thank you. You're amazing. I appreciate knowing you, and that all the value you gave to our community today is just priceless. You're a powerhouse, and I'm going to yield the mic. Whoever wants to ask Anita anything, but did you say that they have a non-invasive blood stuff and vaccine? Did I hear that? Because my son's in my ear with this video.
Oh, is he there? Hi,
Yes.
Gigi. How are you? So yeah, so where we're at with that is there is vaccines that they're thinking about for that it's the most innovative. So what I went was with the staples that we already know, chemo, radiation, but there are the newer things, the newer treatments, is one of them being vaccines. And then the other is biomarkers. Because if you recall, some of the breast cancers are protein. So for instance, in the Black women, we have TNBC, triple negative breast cancer. It is a protein that happens to be in the African American gene. Mutated BRCA1 and BRCA2 is also a protein. We mostly find it like with Angelina Jolie in a different race. So there's a protein that we look at, and those are the biomarkers, which is done through a blood test. And those are usually genetic. So when say your mom or your sister or somebody has it and we hear that, I would then ask my provider, can I get a blood test too?
Love it. Thank you. Anyone else wants to ask a question, please unmic.
So please ask the question, but I want I'm going to take 2 or 3 questions, but I would love for you to begin with, what are you grateful for? And then ask your question, please.
I have a question.
Kim, go ahead.
Yes. Okay, so I'm grateful for waking up this morning and having a healthy family.
Amen.
Now, my question is, my mom had breast cancer and my aunt had breast cancer, but they were diagnosed in their 70s. I'm turning 50. So I'm very cautious of it. I get mammograms, but should I worry about it now, or because it runs in the family, is that something that maybe when I'm 70, I'll get because they both got it in their 70s?
So no, yeah, if your mom has it and your sister you mentioned, is that
Her sister.
Her sister, so it's a strong linear family. I would tell you to get a a mammogram and an ultrasound. Absolutely. Okay. And I would tell your provider that you have that breast cancer does run in your family, in case there is a genetic test that we can do, because in different communities, regardless of whether your race is, we have different blood types we know, like for instance, in the African American community, I just mentioned TNBC, which you might want to check, triple negative breast cancer. I don't know what your mom had, but those are very important. You need to get your mammogram and ultrasound now. I hope you've done one, but I
do them every year. Yes.
Okay. So then what I would now do is also ask for a biomarker, because we have
Okay.
some of them. Because that's
Okay.
great that they mammo and ultrasound and they haven't seen anything. But the key is to try our best to pick it up sooner. So that
Okay.
way we can take measures and not have women die from breast cancer.
Awesome. Thank you.
You're
And Kim,
welcome.
what I'm gonna do, guys, for everyone that's on here, I'm gonna chop everyone's speech up because Kim, you missed the first lady and her beginning. She was giving ways of how to prevent it, lifestyle ways. So I'll give you the recording afterwards.
Awesome. Thank you.
Back to you, Mary Kim.
Is there any more questions on here?
You're
Melissa,
muted.
you're muted. Melissa,
Sorry.
you're muted.
Anita, thank you. Thank you so much. And interesting, I do a 5-bullet gratitude list or more every single day. And my number one gratitude is God for protecting me and giving me good intuition, God for easing my fears and directing my attention toward people I can help, God for giving me patience, tolerance, and love, God for giving me the ability to let go of resentments and forgive, and God for helping me to maintain emotional, spiritual, and physical health. That is
I
my
love that.
day.
I love that. Great.
It's funny you say that. I have because I am a breast cancer survivor, but for my siblings and for my others, I have them mark dense breast, family, heritage, and everyone in my family gets an MRI. So they get a mammogram, an ultrasound, and an MRI. And I do have biomarkers as well. So it's interesting. And BRCA runs in my family as well. I am BRCA positive. So.
Oh, you are. So there's a good example of protein. So Melissa's BRCA1, BRCA2, mutated gene. And Angelina Jolie, did you choose? Do you mind speaking to have a bilateral mastectomy or?
So I started with ovarian cancer. Usually you start with breast cancer and go to ovarian. I was the opposite, ovarian to breast, because I had no ovaries, fallopian tubes, cervix. I chose lumpectomy. That was against my recommendation of my oncologist, Dr. Deborah Kopko at Memorial Sloan Kettering Cancer Center.
Sure.
I chose lumpectomy for my left breast and my right breast. We continuously monitor. I do have markers as well. If it came to the fact where I was going to risk and get breast cancer again, I probably would take the double mastectomy now. I was diagnosed with cancer originally, ovarian, at 37 years old. So in essence, I hit menopause at 37 years old.
Sure.
Which was, shocking to the body. So I was 42, 43 years old when I had the breast cancer. Very, very blessed to be alive. But I really believe, like you mentioned, it's a lifestyle. It's a mind, body, and spirit. It's physical. Because of the changes that I made, like I have a water mitigation system in my house. I have air radon mitigation system in my house. I have water mitigation system in my house. I have a water purifier in my house because what you put on you gets in you. So I loved your presentation. I love your passion. And thank you for helping so many.
Thank you, Melissa. I appreciate you. Are there any other questions? I can take one more.
I am thankful.
All right, Miss Brown, let's hear what you're grateful for.
I am grateful for waking up in a good mindset this morning. I woke up feeling so good this morning. It's been a little rough for the past few weeks, but this morning I'm just thankful for this waking up feeling great. My question actually has been answered, but meaning for us African American women, should we get tested more often, meaning that our type of cancer is a little bit more aggressive? So meaning that we get tested, we get the mammogram maybe like once a year. Should we go every 6 months, or once a year is the most recommended part of getting the mammogram done?
So good question. So it's very rare. It's a very rare percentage, very minimal. I think it's like 9 or 12% that African American women, Black women, get diagnosed with TNB. It's triple negative breast cancer, TNBA, right? BC. So this American Cancer Society recommends just an annual right now. It's hard to even get women to do that. So we're thankful that they do that. But I would recommend an annual. And if you have cystic breast, which are very common too, and dense and heavy or bigger boobs, it says save the tatas and also get an ultrasound.
Thank you so much. But okay, now breast cancer is not in the family, but other cancers are. My family is kind of, especially on my mom's side, they really secretive on things. So a lot of things I'm starting to find out. So cancer does run in the family. My grandmother died of throat cancer. Her brother died of bone cancer. He had bone cancer. And my father had, has, oh my goodness, it does with the bowels.
Colon cancer.
Yes, colon cancer. And his sister had some type of cancer as well. So is that a high chance of me in making sure I stay on top of everything to make sure it doesn't run into me?
So my thoughts on that is you do have a strong family history. So yes, thank you for being here with us today. And with that being said, I think that you should definitely keep up with your annual physical exam and blood work, because that's the first detection, because you're talking of so many various cancer. What we're talking about is more focused on breast cancer. So if your family has your mom or your mom's sister, they have more breast cancer, if you know that, I would definitely speak to your doctor. But you're talking about you just have a strong family history of cancers, all of various sorts. So I would keep up with making sure you do your annual physical exam. They do blood work and a CBC. We can pick up based on white blood counts and various other labs what's going on. There's something looking different in your lab work, and we'll take it from there. That's how we diagnose leukemia. People with leukemia are walking, they have no sign of breast cancer, either do breast cancer people, but we do blood work. But because you have your father, your grandfather, and everybody's I call it my family I call it the family of secrets, because I have to pull everything out of them. I have to pull. Did you have breast cancer? Well, nobody needs to know that. Well, I do. I want to. Well, does anybody have ovarian cancer? Well, that's private. Why would you ask me that? Well, it's important to me too. So I understand I call it the family of secrets. And I'm just like, as you can see, I'm quite the opposite. I'm the family of transparency. I'm like, tell me, it's reality, it's the world. So I can so relate to that.
Thank you.
You're welcome. Thank you guys very, very much. I appreciate all of you.
Thank you, Anita. Thank you, Anita, so much. I'm the family of transparency and grew up in the secret household, right? So I love that. But I love that you touched on gratitude and your mindset, because I know it's so crucial and so important. So thank you for everything you shared. You can definitely, Anita, how can people connect with you? What's your Instagram? Can you share that and all that stuff?
So I am on Instagram.
Put it in the chat, because I know no one's going to remember it.
Oh, sure. I'll put it in the chat before I head off. Okay, everybody? And
Thank you again.
You're welcome. Bye-bye. I'm going to stay on for a few minutes, but I enjoyed being here. Please reach out to me. Anybody, any questions? Thank you.
Thank you again, Anita.
You're welcome, Mary.
Which gives us great transition about gratitude and mindset and all those things. And I'm super excited to introduce my friend, Kimberly Fisher. We met in 1990 at college, first year of college, Berkeley Business School, in New York City. And we've been friends ever since. And we are the same age. She turned 50 this year. I'm turning 50. Tina's turning 50. So we're the 50 and Fly fabulous group. Hi, this is my son. Yeah, hi, handsome. Thank you. And I'm so. Can you please? Yeah, thank you. So I'm super excited to introduce my friend Kim. She's gonna share her story, and I tell her this all the time. So I think she'd be okay saying this. I say it straight to her face. Kim, I've known I don't know, 1990 to now. That's a lot of decades. I can't figure out the math. But she's always been super supportive, a friend I can always lean on. We hung out all the time. But she also was very negative, like negative Nelly type of environment. Not environment, but the way she spoke, right? And I've always spoken to her, and I was like, "Oh, do this, Kim, do this." And she told me this year about her breast cancer diagnosis, and I was like, and while I'm on the phone with her, and I hear her say that, I'm like, of course, oh my gosh, my friend has breast cancer. But I was like, what am I going to do? What tools am I going to be able to use to help her think positive? And I was like, this is extra than everyday life, right? And as she's talking, she's like, but I'm so grateful. I'm so positive. This is what I'm doing so far. And blah, blah, blah. And I'm like, wait, Kim? I literally started like,
Who are you?
Is this the Kim that I've known my entire life? So, and I say to her all the time, she'll tell her story. We're going to have this conversation. But I truly think because of her mindset, because of her positive outlook, because of her belief that she can make a difference, really has allowed her to be where she is today with it. And she labeled herself Kim Possible from, I think, the moment that she got diagnosed. And Kim, all things are possible. So you want to introduce yourself, tell a little about your story. Like, you got the mic and we're going to have this chat.
Absolutely. Hello, everyone. Thank you so much for having me today, Mary. So my story is very recent. I was diagnosed with breast cancer in February of this year. It was a bit of a shock, as to my knowledge, breast cancer does not run in my family. I'm not sure about my dad's side because he did pass away when I was 8. So I really don't know about his side, but it does not run on my mom's side of the family. It is about self-care and prevention. Ladies, do your self-exams, because that is why I'm here today. It started, and I'm going to try not to say all the time. It started before last year. I was in the shower and I was washing and performing a self-exam, and I felt a lump on the side, and I immediately freaked out, called my doctor, and she wasn't available. And I said, I don't care, get me in to see any doctor. We went in there and I had to go see a specialist. So I was very cystic and I had dense breasts, and I always had ultrasounds on top of mammograms. I had a lumpectomy when I was 36 years old, which came out benign. And since then, I've been having mammograms once a year and ultrasounds twice a year. I saw the specialist, and he was monitoring what I found during my breast exam. And I was laying on the couch one day, and I leaned over, and I don't know if I had an itch or whatever, but I felt a lump, and I'm like, what is that? And it was something that I have never felt before. It felt like it was the size of a softball. Of course it wasn't, but that's what it felt like. So I wasn't too concerned, because I actually, praise God, had an appointment with my specialist that Monday, and I had found this on Tuesday or Wednesday. And I went in to see him, and I told him. He immediately did an ultrasound. And unfortunately, he said, I'm sorry, I can't tell you that that's a cyst. I need you to get a biopsy. So I went in on his recommendation, and I got a biopsy. And I have to tell you, that was the longest 3 days of my life waiting for those results to come in. And I got a call from the doctor, and, I was working from home, and, I'm working and I get the call. So I stop and I take the call, and he's like, Kim, I'm sorry to tell you, but this is the real deal. You have invasive carcel ductinoma, stage 1. And, we need to proceed with treatment. So I went from there to my doctor and discussed options. Now, of course, my initial, I cried, obviously, when I found out, because it was a complete shock. I never in a million years thought I would have breast cancer. It's like I wasn't a big breasted woman. So I was like, I don't even have breasts. How can I have breast cancer type of thing, but unfortunately, it doesn't matter the size of your breasts. It is there. And I called my boyfriend immediately, and I was crying and I couldn't get it out. And I finally got it out, and he's like, I'm on my way over. And he hung up and came over immediately. I've had a good few cries over it, but it was instantaneous, where I decided that I am going to remain positive through this. My first thought was, it's stage 1. I caught it early. And that is a huge thing. And, I have friends who were diagnosed in stage 3 and are cancer-free today. So I knew I had great doctors. I have what's known as the A team here. I had Dr. Rimmer, Dr. Lickstein, and Dr. McKean. And I'm so grateful to all 3 of them. I was going to have a lumpectomy. That was my first choice. But when I had my MRI, they did find 4 centimeters of in situ, invasive ductal carcinoma in situ. And I was like, wow. So there's a lot more going on there. And I didn't want to take the chance of having to deal with this again in 3, 5, 10, 15 years down the road. And being that it was an aggressive cancer, I did make the decision to have the bilateral mastectomy. It was a hard decision, yet it was an easy one too, because, I wanted to be here, and I wasn't going to let anything stop me. So I'd made that decision, and I had my surgery in April. When they were in there, they did find a 3rd type, which I did have a little a lobular, and it was very small, thank God. But if I had not chosen the bilateral mastectomy, that may have grown, and that type of cancer would have required chemo. Talk about gratitude. I am so grateful that I did not need chemo, and my margins were negative, and I did not need radiation. So I walked away with a bilateral mastectomy, being cancer-free, with them removing everything. I am doing hormone therapy. That was another tough decision, because do I take it? Do I not take it? And I want to prevent it as much as possible. So I am doing the hormone therapy and taking medication. Positive mindset is everything. It really is everything. I have had an amazing support system. My family, my friends, my unbelievable friends, my good friend Sue, she labeled me Kim Possible, and gave me a sign, balloons. She threw me a booby cue right before my surgery, and we went into this. She is also a survivor, and she was my rock through this. And I'm so grateful to everybody. I'm grateful that you allowed me to share my story, because this is the first time I'm going public sharing my story. Of course, family and close friends knew about it, but it is breast cancer awareness. And I'm a firm believer that if you catch it early, you have a greater chance of being here to tell your story and to spread awareness. And ladies, please do your self-exams. It is so important. And get your mammograms and get your ultrasounds, do your follow-ups, whatever your doctor recommends, please do that. So that's my story, and I'm here. I'm grateful. I have my little ribbon who keeps trying to turn. It's like Ribbon's Gone Wild. She's there.
Girl, that was amazing. Thank you, thank you, thank you, thank
Yeah.
you.
You're
And
welcome.
you made me think. I put something in the chat. I'm not sure if you saw it, Anita, but do you guys know anything if someone has implants? And I say that because Kim, you made me remember something, and I can't imagine what you ladies are going through who had breast cancer a few years ago. Well, a few years ago, I got an examination, and the doctor said, I don't remember what he said, but he's like, we have to check a deeper test. So for a little while, I was in that zone of I might have it. And the first thing I did was called my life insurance company. I was like, do I have my life insurance? You know, so just so grateful for you guys for sharing this to go even deeper. Any questions for Kimberly, anyone? Like
I do not have a question. I just want to say before I yield it, I'm not trying to be a mic hog, but Kim, I'm so proud of you. You did not tear up, but I'm tearing up because I'm so
Oh.
proud of you. So
Thank you.
thank you for being here, and I'm going to yield the mic.
Yes. Thank
I
you,
just
Mary
wanted to
Kim.
say congratulations. That's amazing.
Thank
Been through
you.
it
Thank you
myself.
so
I
much
know.
for sharing your story, Melissa. I've learned so much, and I have adopted a healthier lifestyle. I am transitioning away from the sugar, away from the caffeine. You know, I do have my cup of tea in the morning with a little bit of half and half, but I'm getting much better, adding more fruits, more vegetables, less fatty meats. So I am definitely
Did you say
transitioning
less
into a
fatty meats? I thought you said fatty meats to eat.
Well, like beef, I am trying to reduce. I usually eat a lot of beef, so I'm trying to reduce that and eat
Okay.
more lean protein
Okay.
with turkey
Okay.
and chicken and
Gotcha,
um,
gotcha.
yeah.
Gotcha,
So,
gotcha.
and then I
Alrighty.
also put a warrior sticker on the back of my car with a breast cancer symbol. So I'm hoping that I can
So are you cured now?
remind
You didn't have to
ladies
get,
out there, be
you
like,
didn't have,
oh, I need to schedule my mammogram. So if I can get one woman to see that and schedule her mammogram, that's what that sign is for on the back of my car.
so Kimberly, you're cured now? Is that how it works? You don't have it anymore?
So yes, you know, I am cancer free because they have removed it all. So that's why I consider myself a warrior and a survivor, because I am cancer free, but I am doing the hormone therapy as a preventative to stop more cancer from coming. So, you know, I'm kind of new to the whole warrior and survivor thing. So it's so recent, you know, it was just February of this year, had my surgeries in April and June. So I'm done with surgeries, no complications, praise God again. So I am a survivor.
Thank you, thank you, thank you, thank you.
Thank you
Alrighty,
so
guys.
much.
Yes, we are transitioning to this beautiful queen right here. And it's probably, she doesn't know this, probably because of her while we're having this event. I don't know how many years ago it was. It was a while where she said, we met at a gym. She was taking my classes and she said she had to speak at an event for breast cancer. And I went with her and it was amazing. So Deborah, thank you so much for coming through. I'm going to throw the mic to you. You've done this several times. So rock and roll, girlfriend.
Thank you so much, Tina. I'm already tearing up and I haven't even started my sharing. It's a pleasure and an honor to be here this morning. Kimberly. I take my hat off to you to be able to share, you know, so soon, going through this as you transition through this journey. It is a journey. You're now a member of a club that no one would willingly sign up for, but once you're in it, you see all the blessings and wonderful things that can come from such a very trying situation. I want to thank Tina, Elite Stars, Renee, everybody who had something to do with putting this meaningful, valuable, informative program together, because we all need each other. You know, it doesn't matter race, gender, we all need each other and we all have different stories. And again, I thank you, Melissa, for your sharing. Dr. Anita Singh, it's just been, and then we have Mary Kim, who's just, I thought Tina had the energy, but I see where Tina gets it from. So rah, rah for everybody. It was, well, before I even begin, this is the way I start my day. We mentioned the affirmations, and I'm going to be looking at my notes because when I do it in front of people, I always lose a spot. But my affirmation that I say daily is, I got up this morning saved. And that means that I am healed, delivered, protected, preserved, and made whole. There's not a feeble part to this body. This body. I am more than a conqueror. Every fiber of my being is blessed. I walk today in health. I walk today in wealth. This is true because my Heavenly Father says so. And if I can believe it, I can receive it. So I thank you. I say that every day whenever I take any kind of medication, I say that. Because when I was going through my journey, I did affirmations, me and my mom. At the time I had my mom. And she would read them with me. And I would do my affirmations, and that was like another form, as you say, mindfulness. You know, it is so important, your mindset when you're going through a journey like breast cancer. So let me try to begin at the top. I do kind of get all over the place, so I hope you'll all just follow me. I was diagnosed in 2004. I'm celebrating 18 years. Hallelujah, glory! 18 years. 18 years. Yep. You just keep counting, Kimberly. You just keep counting every year. When I got the news, well, let me back up a little bit. I had my first scare at the age of 25. When I was 25 years old, I had found lumps under my armpit, under my left armpit. I felt a lump or two lumps. And I ran to the doctor because I come from a family. My family is always, health, eat right. My growing up, all I heard was, don't work when you're going for a job. Don't worry about salary. You want that insurance. Insurance was always more important than, I got to have a big salary. You want to make sure you had a good health insurance plan. But anyway, I went running to the doctor, and thank God, because this is going back, y'all. We're going back old school. Back in the day, that he had the foresight to send me at 25, because a lot of women will say, well, they told me, you're too young, it can't be. But he had the fortitude, and he sent me for a mammogram at the age of 25, way back all those years ago. So I went. Luckily, it turned out to be cyst. And apparently I had a pattern of developing cyst. And I did a lot of research, ended up getting a specialist, finding out I was ingesting too much caffeine. I was, at this point, I couldn't believe I was ingesting caffeine. Again, we're going way back. I'm just in my 20s. And I felt, because I am not a coffee drinker, what caffeine is coming into my body? Not realizing it's in coffee. It was at the time I did drink soda on occasion. So it's in so many other things. But again, I thought, well, I don't drink coffee, so I'm not getting caffeine. So that led me to be followed with a specialist. In my 30s, I watched my diet. Everything was great, being followed. I had no more problems. I did do my mammograms, my annual exams, self-exams. I always was on the alert for different things that could possibly happen in your body. And I will just say that I had a mammogram in December of 2003, which was clear, great. And you get used to those. All good, go home. You take it for granted. And as going to 2004, because that was December of 2003, that summer, I noticed I was feeling a sensation in my chest area. But at that time, I had just started getting I had gotten a Nordic track or whatever. I was getting reinvigorated with my exercise program. So I'm like, oh, it's nothing. This is like July. By August, I'm getting ready to go on vacation. So, doing a breast self-exam is the first thing from my mind. I'm in the dressing room, putting on clothes, taking off clothes. In that moment of just trying on garments, my hand brushed over my breast and I said, something's not right here. And I felt a lump at that time. It was after work. If it had been during working hours, I probably would have ran to the doctor right then and there, right? You get like the horrors because something told me this isn't right. So the next day I immediately did the steps, called the doctor, went in. And I'm saying, but I just had my mammogram in December. So I'm thinking, and everything was fine then. So he says, well, let's go through. We're going to go through, get another MRI, get a mammogram. We got to see what's going on. Long story short, when I got the mammogram and I get the diagnosis that yes, indeed, it is breast cancer. I sat in it was my breast surgeon who gave me the news. I felt there was someone else in the room she was talking to because I was like, this can't be me. You're in such a state of, I don't know if it's denial, disbelief, because I'm the youngest I have two older sisters. I had mom and dad, and no one in my household, breast cancer, where's it come from? I'm saying this is impossible. Nobody, and when I say my family, I'm thinking in my household. The only relative I was aware of was my mother's first cousin, who I watched her go through her breast cancer journey. And she was in her, I believe she was in her 60s, maybe late 50s, 60s. And that was I watched her go through it. And, it was a sad, long journey. And I still felt totally detached. I said, okay, it's my mother's cousin, first cousin. So I guess that meant my second or third cousin. I just felt invincible. Health, nutrition, I exercised, I ate well. Yes, I did my little dabbling in your 20s, 30s, you do your little partying and stuff. What they call now CBD, but we won't go into that. So I felt like I was pretty healthy. I hadn't had a major illness up until this point. When she told me I was diagnosed with the disease, my biggest fear was, how am I going to tell my mother? Because, you worry about how are your people, your loved ones going to take the news? Because again, I was probably still in some sort of degree of denial. So I get it. I got the love and support that I knew that I would have, thank God, a blessing that I had the love and support of my family, my entire family. It was very important, as you say, the mindfulness, that you have a barrier of positivity around you. And even if it means having to keep some people at arm's length, and that could be family members, that could be friends, people you really, thought would be your support, and you see you're not getting that support, you have to shut them out if you want to fight this battle with everything that you have. That's what I had to do. And I just thank God for I had a wonderful church support, my family, I had friends, and I'll never forget the love and support that I had. And I know that's what helped me to get through. I was diagnosed with a stage 2 breast cancer in the month of August. Mind you, my mammogram was clear in that December. So yes, it's true that Black women tend to have more aggressive cancers for the genetic reasons, environmental reasons. There's a whole host of reasons. And the support group that I belong to, Sister to Sister, they are strong advocates trying to battle the health disparities in the Black community. And in, low income communities, people of color in general, they are trying to battle the health disparities that still exist, unfortunately, today. I went through my treatments. I was in treatment for about a year. Maybe a year and a half. With stage 2, I had 6 months of chemo. How did I make the decision for chemo? As you say, it was hard and easy at the same time. I had a lot of people in my ear telling me, you don't want to take that poison. That's going to kill you. It's going to do worse than the disease. And, but I thought to myself, I said, Deb, if you have the blessing to still be here 5 years down the road or 3 years down the road, you want to look back and say, did I do everything you felt you could do to make yourself well, to eradicate the disease? And I thought about it and I said, what if you weren't in America? What if you were living in a third world country? And, and I was thinking about all the women in the third world countries who would die to have, literally, who are dying because they cannot get chemotherapy. It just helped me to think. I said, if I couldn't get it, I would want it. And that helped me to make the decision. I said, I'm going to go with everything I've got. And I made the decision to go with the chemo. And and everybody's journey is extremely individual, because like Melissa said, she pretty much lived on the bathroom floor. I could say my worst chemo was my first chemo. And once they tweaked it, I would go for follow-up chemos and I wouldn't get as sick. I would, I would not be well. The first day chemo, I felt great. Second day after chemo, felt fantastic. Third day, yes, it was like a bomb. And I would be, sluggish, couldn't do much, and just not feeling quite there. And it would take me like the 2 weeks in between. By the time I'm feeling ready to go again, it was like, boom, time for another treatment. So it was, a price to pay. But I'm thankful because I can say I've got 18 years. And I can say I remember clearly my last day of chemo. I was on Valentine's Day. It was Valentine's Day. And I'll never forget that. And then after the chemo, I was prescribed to go for radiation. And I hear a lot of different stories about people who endure radiation. And a lot of people say, oh, my skin burned a hole, it burnt a hole for me, etc. And I could see how that can happen, but thank God the facility, the hospital that I was being treated at, as soon as we finished the treatment, they gave us a solvent, Aquaphor. It's like Vaseline, but I think it's more medicinal, it has more healing properties. And they would give it to us by the ton. So before you got dressed, you could, put on the spot, and I would religiously use that Aquaphor. And I didn't have any problem. And of course, when I got home, I would be loose and free, put on a t-shirt or bare chested, just to not have anything, irritate the area. So I did 6 weeks of radiation, and I go for my final, what I thought would be my final, doctor appointment with my oncologist. I'm thinking he's gonna tell me, you're ready, you graduated, you're done. And at that time, a new drug had just come out, Herceptin. And he said, Deborah, you could stop now, or if you really want to give yourself the best outcome, I would highly prescribe you taking this new drug called Herceptin. Yes, you'll have to go back to the infusion room like when you were getting chemo, but you know, you don't have to go as often, but you prescribed it for a year. And I'm like, oh my God, I'm here. I'm thinking I'm done, but I'm going on for another year. I go for the treatments and I was able to endure them for about 6 months. That December, the last treatment that I had to go to the emergency room. And, you know, at first I was told, no, it had nothing to do with the drug, but eventually it came out, yes. And it was just that my body was rejecting it. I had just had enough of enough. So you will know the signs when you know what to do. And what I tell people when I have these talks is check yourself, check yourself, check yourself, because you will know before anybody there's something amiss, there's something going on, and I've got to get this fixed. Now, like I said, while I do breast exams and was doing them, I did not, I wasn't doing a breast exam when I found my, you know, lump. It was a lump. And I had my lump removed. Before the chemo, I had a lumpectomy. I had the lump removed, and they also removed lymph nodes. And that was very important. And I'm just thankful that they only had to remove 2 lymph nodes. I hear women who get 20, you know, 15, 20 lymph nodes removed. So I was lucky there that they only found it maybe in 1 lymph node, or, you know, so I was very fortunate for that. I was very fortunate. I heard not till after I did the chemo, you know, how it affects your teeth, it affects this and that. And, you know, I did my research, you know, I lived online to find out, you know, about different things, you know, that could help me. I wore my juicer out. I was into nutrition. And before I was diagnosed, because I was into fitness, I believe that helped me to get through the journey. And again, I met Tina, I probably was about 8 years after my chemo, 8 to 10 years after going through the cancer journey. And being around her with her fitness, her elite stars, and she says this morning we did not have class, but Tina is in your head. See, Tina gets into your head. So when there's no class officially, you're like, this is what we do. So I did my 30 minutes this morning because I'm like, she's going to ask me, what did you do today? So she, you know, it's good to have, you know, that support around you because it will help you stay on track. Yes, I get off the rails sometimes. You know, you don't feel like doing it, you don't have time, work, other things get in the way, but you get back to it. And it's a help. And it's, you know, really been great to be a part of Tina's circle, her tribe, as she calls a lot of the time.
I love you, Deborah.
So, you know, it's been a journey. When I see young people like Kimberly, I just say, God bless you. Recently, I do have to say, you know, like, while unfortunately, it's just women I see on this dashboard, I do want to let you know that about 10 years ago, I had gotten the news that my dad was diagnosed with breast cancer. He was the age
Recording in
78,
progress.
the age 78. He was at 78. And it was shocking. It was shocking because no one wanted to tell me. I had to kind of find out through the back door. So that was a double shock when I found out. And me and my siblings, me and my sisters got together and we had to make the decision on his treatment because the doctor, the surgeon suggested chemo. But at the age of 78, we could see my father, you know, slowing down and, you know, getting a little frail, you know, and we felt that the chemo would just quicken his, you know, I guess, demise. So we agreed to having the lump removed and any and all medication other than chemo. He did very well. First 3 years, he did very well. And then he went into remission. The cancer was gone. And the cancer was gone for about 3-4 years. And then the cancer came back, unfortunately. And when it came back and it metastasized. And he fought a valiant battle. for about 3 years. And we lost him last year. And as you can see, it's still very difficult. Because you don't, to watch him, he never complained. He had very good care. My sister took care of him. She was his primary caregiver, in addition to me and my other sister providing support. I'm from New York originally, but I've been living in New Jersey for a very long time now. So the care, she was there with him 24/7, giving him the best foods, getting him to every appointment, and he did have the best care. And it was just very hard on the end because he would just be in the bed and would not move at all. Never complained. I would imagine he must have been in all kind of pain. So, for the men who think it's poo-poo and it's just a pink thing, it is not. My dad was a retired New York City fire marshal, and he was an airman in the Air Force Reserve and in the Air Force. So, there are a lot of different reasons, genetics, environmental, when they say, well, we don't know why Black women tend to, but in addition to the genetics, it is a lot of environment, because a lot of the Black communities seem to be subjected to a lot of toxins where they live, when people live in, congested areas. So, and then you have the Ashkenazi Jewish population, who also, that's you, Melissa, right? And they have a very high genetic profile for getting breast cancer and having the BRCA gene and everything. So there are, like I say, we all need each other, and it's not like an isolated thing. Well, white women get it more and Black people have aggressive and Ashkenazi Jews. Everybody, it affects all of us, men, and if it's in your family, then that's just giving you a sign to just be more proactive. If it's not in your family, you should still be proactive, because again, when I was diagnosed, there was no one around me. I'm saying, where did this come from? Why is it happening to me? Again, I had 2 older sisters and I'm the youngest, and I just didn't know why I got to be. But I said, you know what? Now that I still go to my oncologist yearly for my yearly exam, and I do not leave without going back into that infusion room where I was sitting 18 years ago being treated till I would be falling out from the drugs. And I go back there and I say, you know what? I was in your seat 15 years, 16. I tell them, you're in the right place. I feel that it's the least I can do to show my appreciation for the gift that God has given me to be able to stand. Because I'll tell you, as I close, because I know I'm going on and on, there are times I forget I had breast cancer. But at times like these, when the month of October rolls around, or when someone else, I hear of a diagnosis, but I feel so good. Glory to God. Thank you, Jesus. Yes, I have to watch my bones. I'm at a point where, from the treatment, my bones are a bit more susceptible. So I'm taking supplements for my bones. And again, your diet, eat clean, try to keep your mind as healthy as possible, and just try to be as positive as you can, because your mindset, I think, is just as important, if not more, than even the medication.
Thank you.
So I thank you. I thank you.
Wow, Deborah, that's impressive. Thank you, thank you, thank you, thank you. This is going longer than I thought, but it's okay, because you all are making me aware of how important this is. Whew. And again, like I said, I'm chopping everybody up so that we have it and they can add it somewhere else. Up next, we have this beautiful queen right here. And again, she's an Arbonne consultant, Melissa. Melissa, how long have you been with Arbonne? Because I know you were longer than I was.
Oh, actually, Tina, I didn't join that much. So I've been with Arbonne for 8 years. 8 years. But I found Arbonne through praying to God and asking God what I needed to get off of radiation, chemotherapy, and to be a cancer survivor.
Gotcha.
So What I recommended was, for me, I literally lived, like, and I said, when I speak at Arbonne conferences, or I speak at health facilities or universities or hospitals, this is what saved me. I could not eat. I lived on Arbonne protein shakes. Even if it took me a whole day to get one shake down my throat, it gave me the nutrition that I needed, without poisoning myself further. And it's very interesting because I believe you can't poison yourself to health. I think you can give you nutrition to help to health. So Deborah, I thank you so very much. And when you talk about your dad, and my heart sunk, and this is what I lost my childhood sweetheart. He was more the husband, July 21st, 2021. Then I lost my best friend, August 2nd, 2021. And my oncologist said to me, stress manifests cancer. You need to grieve healthy. I have a grief counselor, and I got married again on September 10th of this year. And what happened was my best friend, my best childhood friend. So I lost 2 childhood friends and like people I loved last summer. And then on her way to a rehearsal dinner, I lost her in a tragic motorcycle accident. She never made it, but no one would tell me. And I thank God they didn't tell me. The moral of the story is my oncologist is very worried because I lost the 2 closest people to me last year. And I lost my best friend on her way to our rehearsal dinner. And she wasn't at my wedding, but in my wedding picture, there's a rainbow across John and I. And her dad said to me, that was Eva. She was there with you in spirit. So I get it. But my oncologist has emphasized you need to meditate, you need to pray, you need to exercise, because grief can bring on cancer again. She says, make home as peaceful as possible. We all know our jobs are stressful, so make home the sanctuary. So I'm so sorry for your loss. I know what that feels like.
Melissa, thank you for sharing that, especially the part with make your home your sanctuary. And we never realize how strong stress is. And I said this the other day, not only the things that you guys are saying affects breast cancer, but also high blood pressure, cholesterol, diabetes, all that stuff. So thank you very, very much. Whew, all right, I'm throwing it over to my girl, Joyce, who's amazing. Now, Joyce, when Dr. Anita was speaking, did she mention the cancer you're about to talk about?
She did touch on it a little bit. She made a mention of some of the things you could have if you had that type. So hello, everybody. I am just so grateful to be here, honored to be here with Tina and all of you. You know, today, as I listen to everyone, the one thing that, you know, is a thread of why we're here is the word cancer. And I'm just asking everybody, when you hear that word cancer, just for a second, just think about how it makes you feel and what it brings to your heart and your thoughts. I find that, you know, I've done a few talks, and that word cancer, I find that some people feel really scared. Some people feel sadness immediately. Sometimes it reminds us of our mortality. And for you guys here that are the survivors, Deborah, Melissa, Kimberly, you guys are, I just see you and I see your strength, and you guys are amazing. You are the true heroes. You know, you guys fought this battle and you're just amazing. So most of us here have an emotional connection to the word. And for me, I know the word very intimately. I have not had cancer, thank goodness, but back in 1999, my sister, who was my best friend, called me and she said, you know, I have this rash on my breast and, you know, it doesn't really look right. She said, oh, I went, you know, maybe a month before that, and I went to like a walk-in, and I asked about it. They gave her like some cortisone cream and sent her on her way and said she'll be fine. And so this was probably a month later, and it had gotten worse. The rash had gotten worse. The breast had become inflamed. And so she said to me, will you come over and look at it? You know, as sisters do, we share everything. And so I went over there. I was working. I went over like, you know, a day or two later, because a rash on the breast, you know, who would think? So I went over and she showed me her breast, and it was inflamed, and the rash was, the doctor had said like it becomes, your skin becomes a little bit different, almost like the outside of an orange, and that pittedness. And, you know, the breast was swollen, and it was not good. And I just looked at her. I said, you have to see a doctor right away. I said, you know, something is not right. I said, I'm going to go home. I'm going to find out. I'd been a hairdresser for 38 years. I had a salon for 30 years. And in that time, I had so many people that were doctors and nurses that I dealt with. So I had some connections. I said, I'm going to go home and call a few people and see what I can find out. And of course, I went home and Googled it as soon as I got home. And so I got on the phone with an oncologist. I got her an appointment. Of course, it took like 2.5 weeks to get in, the longest 2 weeks of our lives, because you know something's not right, and you just want to get in there and get it done. So we went in to see the doctor, and the doctor looked at her, and the moment that doctor looked at her breast, I knew that Joni was in trouble. My sister was in trouble. I knew that her life was about to change. The doctor sat us down and told us that this was a type of breast cancer called inflammatory carcinoma, and it does not come out as a lump, which most people don't know this. And this has been my mission since 1999, to make sure people know this, and that's why I'm here today. But she said it's a very fast moving kind of breast cancer, and we need to start chemo tomorrow. So I looked at my sister, and you know, Joni was the most vibrant woman. She was 42. She had 4 small children. She had a husband, and she was my best friend, and her life was about to change. Her life, you know, went from, you know, taking care of these kids, and she was homeschooled her children, and you know, she spent every moment with her kids, to now going into treatment and you know, starting her chemo and her radiation. But because it was very fast moving, it wound up spreading to her brain and to her lungs, and her, like within a month, she was in the hospital in intensive care, almost like a hospice. And so every night I stayed there with her. She was so frightened, but so strong at the same time. Like, she didn't want to stay at the hospital at night, but you talked to her during the day, and she was not leaving her children. She was not, you know, leaving her husband. She was not leaving this earth. And she put such battle in. And, you know, so we found out in March of 1999, and she was gone in July of 1999. 4 months, so fast moving, so like and we couldn't believe it was happening, because it was so quickly. 2 days before my sister passed away, my dad called me and told me that he had lung cancer. And I'm like, sorry. I said, you know, this isn't funny. You can't joke like this. And he said, you know, I'm not joking. And so I was like, okay. And then 2 days later, my sister passed. You know, we were dealing with that. After my sister passed away, I went home. You know, I was exhausted. I stayed there every night. I had my own business that I had to show up for work every day. I had 2 small children at home. Thank God my husband was so supportive and made sure everything was running the way it was supposed to. But I just didn't stop for like 4 months. And I got in bed, and I pulled those covers over my head, and I did not want to come out. I was done. So my family was good. They gave me a couple of days, and you know, my boys were so good. And then I also knew as I laid there, my father was sick. I had to, you know, help my brother help him, because my brother was, you know, will be a big help with him. So I pulled the covers off of me and said, okay, I cannot lay here and show my children that this is what we do. We give up. You know, as caregivers, we, you know, it's a whole nother side. I heard, I think it was Kimberly talk about her friends' support and your sisters, Deborah and Melissa. You know, the caregivers and the people that help you really are the ones that you know, help pull you through. And I knew that I had to help my brother, now help my father. And so I had to stay strong, and I had to teach my children that we are resilient and we can keep going no matter what happens to us. So at that point, I decided that I needed to tell people about this type of breast cancer. Anybody I talked to, nobody knew. I don't know, you guys are a little more seasoned here. You may have heard of it or whatever, but most people do not know that you can get a breast cancer without a lump. So this had become my mission, to let women know this. So in my mind, I'm like, okay, I'm going to use my business. My dad was my partner in my business. You know, I took care of the salon part. He took care of the business part. And I said, you know what, Dad, I'm going to start a cut for a cure, and we're going to do haircuts. We're going to raise money, and we're going to put awareness out in the salon about mammograms, about self breast exams, about giving about this type of breast cancer that no one knows. And so that's what I did. So in 1999, in October, I set up my first breast cancer event, Cut for a Cure. What I didn't know is that my dad was going to pass away like 5 days before that. And so my family was like, you need to cancel this, forget it, don't do it. And at that point, I was more determined to keep my sister's memory alive and my dad's. Sorry. So we had our first Cut for a Cure. We raised about $500. I think we gave to the American Cancer Society that year. And I got through it, and it went on for the next 20 years. I did a Cut for a Cure. We raised probably, I don't know, over $250,000, one haircut at a time. We not only gave to foundations, but we started adopting families, because as you ladies well know, going through cancer is so draining emotionally, spiritually, physically, and financially. So we adopted a family, and we would give them money to help pay their bills, to take somebody to Disney World, whatever they wanted to do with this money to make their life better. So I did that for 20 years until I sold my business. And and that's why I'm here today, because I still feel the need to put this message out and to share my story with people, and let you ladies know that you need to do your breast self exams. You need to go for your mammogram. They're so important. And you need to know that you can get breast cancer without without a lump, and that it is a rarer type, and it's also misdiagnosed. So that is what I wanted to share with everyone today. Thank you so much for letting me be a part of this. And truly, you guys are my heroes.
Yes. I just love how we had different perspectives today. We had someone like you, Joyce, who didn't have it, but you had a close family member, and it was so quickly. All different levels and layers and everything. So thank you. We have one more speaker, the final speaker, coming to us all the way from Bermuda. I was a little worried because I wasn't sure if she would be able to hop on because of technology reasons or whatever, but she is my aunt, and I didn't know, that she had gotten it. So Aunt Juliana, how are you? Can you hear me?
Yes, good morning.
Yes, you can begin sharing your story.
Okay, well, I'm Tina's Aunt Juliana. It's currently, I was outside in the garden around the Rose Tree, but it's currently raining right now, so I had to move back inside. So I am now 67 years old, semi-retired. At age 23, when I had my first daughter, I had what I thought was just leaky milk from the nipple. But I also found a lump, and I had my first lumpectomy. And then starting from age about 28, because I always paid attention to my breast, I had to have mammograms every 6 months, and that went on for about 2 or 3 years. And then I've always been an advocate for breast cancer, because I worked in that medical field for many, many years, sent many women off to hospital for treatment, assisted them when they came back, etc. And never thought that one day I would be a patient. So at age 52, one day during one of my exams, I felt some lumps, and I kept checking myself so much that I gave myself bruises. So when I went back to my doctor, who was also my previous boss, he checked, and when I came out of the examination room, he's Chinese Jamaican, so he's very fair. So he was flush red when he left the room, and I said, "I'm got it." And when I came out of the room, his wife and one of my former coworkers were in the office, and they were crying, and we all just cried without saying anything. So long story short, he called right away for confirming mammogram, and the hospital told him, "Oh, we don't have an appointment for about a week." Well, Dr. Wong, it was unprofessional. He snatched the phone out of the secretary's hand and said to the young lady, "Let me speak to your manager right now." And he said, "My previous office manager has, I believe, cancer, and she needs to be seen today. If I need to come over there, do it myself, I want an appointment today." So I got that appointment, and it was confirmed. I had one surgery about a couple of weeks later for a lumpectomy. Follow-up showed that wasn't enough tissue, so they did it again. And then I ended up where it was not working out in anything. And the tests were sent away for testing. They said I still have breast cancer. So I did commence chemo. Am I still there? I did commence chemo 6 months, in June of 2008. And that was the worst time of my life. I had 4 rounds of chemo, but each one was equivalent to like 10 doses. For me, my final dose was not good because they couldn't find any veins to put the IV in. If I ever did have to go to cancer again, and I'm not claiming it, I would get a port. So as time has gone by, I did end up having to go to Brigham and Women's Hospital and have my breast removed. And then I had 39 bouts of radiation at the Dana-Farber Care Center in Boston. Great places to go for treatment. And like I said, I used to send my patients there. So actually, when I arrived at the hospital at first, one of the ladies, she says, "I know a lady in Bermuda. She works for this doctor, and she's very nice. And you might know her, because she hadn't really, she was with the other, was the booking in nurse, and the other lady came in, sorry. And she says, and her name was Juliana. And the lady that was booking me in, she says, "This is Juliana." Well, the poor lady was so upset, she just left the room, but she came back and apologized because she's never met someone she's corresponded with as a patient. So I kind of had a little bond there. So, but the surgery went great. Brigham and Women's, they were there the whole time. I did panic on the day of the surgery, and they called in the Reiki master. And we had a session prior to me going on the surgery, because I was to the point, wow, I don't want to have any more surgery. Just let me go. My mother was in hospital at the time, in a agape house, I guess you will call it a hospice, being treated for bone cancer because it spread to her bones. So the treatment, the surgery was successful. Like I said, I was good. But while I was there, I got a call in November of 2008. Oh, one thing I did forget from the beginning. My 14-year Cancer Thriver anniversary was yesterday, Friday, October 28th. So I'm a 14-year survivor, right? and I call myself a thriver, right? So, I feel great about that. And I just enjoy life. I mean, for me, my motto has always been to my patients, right? I always just say to them, positive thoughts gives positive results. And I live by that. And when my oldest daughter found out that I had cancer, we did share it on Facebook. And she wrote on there, and I've never said this to my daughter. She wrote, hang in there, mommy, we love you. Positive thoughts gives positive results. I'm trying not to cry, but it's like I said, it's just how you live life. I mean, I haven't had the easiest life in the world. I'm kind of a learner, but Tina and her mom, Hattie, they're like, even though we're in Bermuda, they're like next door, if you know what I mean, right? And my sister Hattie was there for me. So going back to the surgery and everything, like I said, I got the call in November, and the doctor says, okay, we'll take out your stitches, and you have 5 days to go home for a funeral and come back. And my daughters just happened to be there, so we managed to do that and everything. And I commenced my radiation, which was in the end, was very painful, because after 39 radiations, I kind of got like a burn. And I remember it was one of the ladies was saying that they give you the cream lotion. I can't think what it's called, Eucerin cream, I think, to put on every time you have treatment and stuff. But the moment Aquaphor, I think that might be no, it's similar to Aquaphor, but it's called Eucrimin or something. It's all the same family. It was very greasy, and you had to put the net on it. It's okay, similar thing, right? But it's real messy, right? And traveling from Boston to Bermuda, that was a real hassle because it was painful, right? But the moment I got home, same Dr. Wong, he came to my house, made a house visit to check on me. And with his Jamaican roots, he came with the aloe in hand, aloe that you grow outside in hand, peroxide. And he asked me, did I have a blow dryer? I was like, what? And he came and washed off all the greasy stuff. And we put on the peroxide, we put the blow dryer on to dry it, and he smeared on the aloe. And I had to do that for 1 week. I can assure you, in 1 week, I was totally healed after having all this pain and burn, right? But my journey, like I said, I've shared with women my scar when they said, we have breast cancer, and I'm an advocate for going braless. Like Saturdays, we don't wear a bra, so you all are privileged to have me in a bra, proper bra. It's relaxed day, right? Those who have been through it, you know what I'm talking about, right? Because the prosthesis can be quite uncomfortable, but I found a nice swimmer's one, so it works for me. But during that time, I mean, I wouldn't wish chemo on anybody. I would not. Give me a second.
Thank you. And like I said, I didn't even know that anything that you went through. Awesome. Now this is going to be recorded, so I will give you your portion. I'm throwing it over to Mary Kim because, guys, I've never felt this way before, so I'm just going to let her close it out. It's just so emotional. It's just taking a lot of my energy. So go ahead, Mary Kim.
Thank you, Tina, for trusting me to co-host this with you and partner with you. And you did all the work. I'm just here talking. But first of all, thank you, every single lady who shared their story, their vulnerability. It is tough, but we're changing lives, right? So now I'm getting emotional. Thank you, Joyce, Jocelyn, Melissa, Auntie Julianne, Deborah. I have contacts on, but I still can't see, so don't mind me. And Kimberly and Anita and everyone, even behind the scenes. Renee, Miss Hattie. I know you're just supporting us all the time. Chris, Cynthia, Miss Brown. I didn't even know that was your last name. I think I just call you Miss Brown from now on. And whoever Samsung is. Miss Hattie, that's you. So thank you, everyone, for being here, sharing your story. And just, this is how we change the world, right? This is how we make a difference. And, the truth, I think I don't know how many touches where people make a decision, but, we have to continue bringing awareness, sharing a story, because there's still so many thousands and millions of people who don't know about Breast Cancer Awareness Month. So I applaud each one of you. I'm grateful for each one of you and just keep being you and sharing your story, because you are. If it's just one person that you affect, right? That's changing them, because when you change someone's perspective and you change someone's life, they're going to share that with someone else. So it's definitely a ripple effect, and you may never know these people, but that's okay. I'm proud of each one of you. I'm honored to have met you all here today, or have you, like my friend Kim and Anita, like so cool that I know you, that you were able to add value to this event. Like I was like, oh, I know two women. And so I'm so proud of you guys, because you know, we have our friends and we don't see them in this light, right? Because we just hanging out and whatever, right? And so like to see you shine and to overcome these things and like, oh, I didn't know my friend knew all that stuff. So I'm just honored, but each one of you keep shining, keep believing, and keep making a difference. And I'm just so grateful to be here. Thank you.
Thank you. I'm trying to take a group photo with the camera up there. Ready, crew? 1, 2, 3. Yay. I'm going to chop this up into little pieces so each speaker can have a copy for themselves. I'm a little late. I have an Arbonne event at 10:30. It was supposed to be at 10, but you guys just touched my heart so much. So I'm hugging you all. And
Thank you,
next
Tina,
year-
for
Thank
pulling
you,
this
Tina.
together.
Yes, this was a
Thank
very
you so
last
much.
minute thing, guys. So next year,
Thank
maybe
you,
we'll make
Tina.
it big and do like a gala next year so we can wear big formal pink dresses.
Thank you.
Ooh.
Yes.
Blessings to
All
you.
right,
God
bye,
bless
ladies.
you. God bless you all.
Bye.
Have a
Take
beautiful
care.
weekend, everyone.
Yes.
Yes.
Good women.
Thank you,
Thank you.
Kimberly.